Good day everyone, good day ma'am, good day classmates. I am Lian Grace Iwakin from BTLED ICT 2C, and my assigned topic is all about occupational health and safety in caregiving, or OHS in caregiving. So, why OHS matters in caregiving? So, caregiving is physically and emotionally demanding because when you're a caregiver, yung mga patient na magiging yung mga patient na i-handle mo is yung mga old people with disabilities or yung mga old people na may mga injuries, may mga sakit, and may mga disorder. So, and also, may mga patient din na mga children who have the same, may mga disorder din, ganun. So, it is physically demanding kasi patient, yung mga patient nga ng mga caregiver is yung may mga sakit, is nakakapagod din talaga yung mga trabaho ng mga caregiver kasi yung may mga patient sila na who can't walk or who can't stand properly, so kailangan nila i-assist yung mga patient nila. So caregivers are at risk for various injuries and illness. So just like what I've said earlier, di ba? Yung mga patient nila is yung mga may sakit or yung mga may mga diseases, yung mga like may mga injuries. Caregivers are at risk for various injuries. So as what I've said earlier, di ba? Caregiver is at risk for various injuries like if pabalik-balik yung mga ginagawa nila or repetitive which is yung lifting and handling the patient. So, and illnesses. So, caregivers are at risk for various injuries and illness. So, here, so caregivers are exposed or naka-expose sila sa mga patient nila na may mga diseases. So, hindi mo naman talaga masasabi na if you're a caregiver na dapat piliin mo yung sino yung aalagaan mo, di ba? May mga patient din talaga tayo na may mga sakit, which is yung mga malulubha, at saka meron din naman yung mga mild lang, yung hindi naman nakakahawa. So, prone talaga yung mga caregivers sa mga illnesses kasi nga naka-expose sila sa mga patient nila na may mga sakit. So, number 1, we have the physical safety. So, manual handling and lifting. So, caregivers are frequently lift or assist with moving patient, which puts them at risk of musculoskeletal injuries like back strains or joint damage. So, here in manual handling or lifting is yung mga caregivers natin is always or palagi nila nililift yung mga patient nila, especially if yung mga nagte-take ng medication, and also if ipapakainin nila yung mga patient nila is binubuhat nila para tumayo or ipaupo sila para nga ipainom ng gamot or ipapakain, which can lead them to musculoskeletal injury. So musculoskeletal injury, it is joint, muscle, and nerve that support to our neck and back. So, what are the prevention to prevent these injuries? So, use an assistive equipment like hoist and lifting aids. So, hoist is a device that used to lift and lowering. So, some of the bed naman, di ba, like sa mga hospitals, may mga beds na yung nalilift at saka nalolower na natin. So, with the use of that hoist, na lalasan na yung mga sakit or yung mga sakit sa katawan ng mga caregivers natin. Hindi na sila nahihirapan kung paano nila papakain, which is if papakainin nila yung patient nila is kailangan ipapaupo pa nila, ganon, ipapaupo pa nila, tapos kailangan if ipapainom ng gamot, ipapaupo din if so. Training in proper lifting techniques. So, yung mga caregiver natin, hindi yan sila kaagad-agad naging caregiver. Steps pa yan sila na tinake para maging isang caregiver. So, may mga trainings din yan sila So, here, training in proper lifting techniques. So, kailangan alam nila kung paano ba paano yung proper way na paano yung proper lifting ng paano yung proper yung patient nila, kung paano nila proper ipapahiga, and paano nila proper ipapaupo. So, team lifting when possible. So, in caregiving field, hindi naman talaga like parang mag-isa ka lang sa isang patient mo, mag-isa ka lang. Usually, dalawa yan kayo or more. So, kailangan is if ipapaupo nyo yung patient nyo, ipapaupo nila yung kailangan may kasama silang magtulong para ililift yung patient nila. So, number 2, we have the infection control. So, exposure to infectious disease in caregiving, particularly in hospitals or long-term care facilities, caregivers are at risk of contracting or spreading infectious disease like COVID-19, the flu, and MRSA. Caregivers are also exposed to infectious disease like what I've said earlier, di ba? Yung mga patient nila, hindi lahat healthy. Some of their patients have diseases like yung like may mga COVID-19, may mga flu or MRSA. So, MRSA is like pneumonia and may mga skin infection. So, what are the prevention to prevent What are the prevention? So, regular hand hygiene, frequent hand washing, and use of hand sanitizer. So, if you're going to touch your patient, if you're a caregiver, if you're going to touch your patient or punta ka malapit sa kanya, and after that, kailangan mo mag-wash ng hands or kahit mag-sanitize ka lang. And also, always wash your hand para hindi ka ma-expose sa mga disease ng patient mo. So, use personal protective equipment like PPE, gloves, masks, and gowns. So, here in use of personal protective equipment, if yung patient mo is like, 'di ba, if may pneumonia or may mga malulubhang sakit, kailangan mo na talagang gumamit ng PPE. Kailangan mo gumamit ng gloves, mask, para hindi ka mahawaan kung anong sakit man meron siya. So, proper cleaning and disinfecting of patient care areas and equipment. So, kailangan is regular yung paglilinis natin sa mga equipment na ginagamit ng pasyente natin. So, as a caregiver, trabaho natin yung maglinis. Trabaho nila yung maglinis ng equipment or yung higaan ng mga pasyente nila. So, number 3, we have the mental health and emotional well-being. So, caregiver burnout. So, the emotional and psychological toll of caregiving can lead to burnout, which is stress and mental health issues such as anxiety and depression. So, burnout, which includes the emotional, physical, and mental exhaustion due to prolonged stress. So, yung mga caregivers natin is hindi talaga na maiiwasan na ma-stress sila sa trabaho nila. Kasi nga, 'di ba, yung mga patient nila is yung mga old people, which is sometimes is mga matatanda, 'di ba, matitigas yung mga ulo nila. Pero may mga iba is ayaw nila uminom ng mga gamot nila. So, paano nila ma-prevent yung ganitong stress? So, providing access to mental health support. Like, so, what are the prevention para ma-prevent nila yung stress? Excuse me. What are the prevention para ma-prevent nila yung stress? So, we have providing access to mental support like counseling and therapy. So, if you're a caregiver and you're experiencing like stress or parang iba na yung pagkaka-stress mo like leading to anxiety na, you should visit a therapist. So, creating a support work environment. So, kailangan is may mag-team up ka, kailangan may katrabaho ka or may kasama ka sa pag-aalaga ng patient mo. Hindi yung ikaw lang mag-isa kasi mahirap talaga. Magiging stress ka talaga if mag-isa ka lang na mag-aalaga sa patient mo. Training in stress management and resilience. So, dito naman is kailangan alam mo paano i-handle yung stress mo para hindi ka ma-burnout or hindi ka magkaka-anxiety or ma-depress. So, number 3, we have the workplace ergonomics. So, repetitive strain injuries, tasks such as lifting, bending, or repetitive motions can lead to long-term injuries like carpal tunnel syndrome or shoulder pain and repetitive injuries. So, here naman sa repetitive injuries, di ba, ano yung mga palagi nilang ginagawa or pabalik-balik na ginagawa ng mga caregivers? Like, for example, is yung lifting and lowering and yung mga papaligo or pinapaligoin nila ng mga patient nila. Yun ang example ng repetitive strain injuries. So, which can lead to long-term injuries like yung carpal tunnel syndrome, which is dito sa wrist, under sa wrist natin. Dito sa wrist natin is yung carpal tunnel syndrome, and also can lead to shoulder pain and repetitive stress injuries. So, what are the preventions? So, ergonomically designed furniture and equipment to minimize the strain. So, kailangan yung mga equipment or yung mga gagamitin mo sa caregiving mo is nasa place lang na maano mo lang. Is yung nasa place lang na maaabot mo lang. Hindi siya sa baba, but so, what are the preventions? So, ergonomically designed furniture and equipment to minimize strain. So, kailangan is yung mga equipment na gagamitin mo, ipi-place mo siya sa mga sa lugar na alam mong naabot mo lang. So, training on posture and proper technique of movement. So, diba, as what I've said earlier, diba, yung mga caregivers natin is hindi sila naging caregiver kaagad-agad. Nag-undergo pa yan sila ng training kung ano-ano yung mga gagawin nila sa field na nga nila, which is yung caregiving or pag-aalagaan ng mga tao na may sakit or yung mga may sakit sa utak, and also children. So, naman in training and posture and proper technique, as what I've said earlier, diba, yung mga caregivers, hindi sila naging caregiver kaagad-agad. Nag-undergo pa yan sila ng many trainings. So, here's one of the example na training na undergo nila, which is yung proper techniques for movements. So, kailangan yung mga caregivers is alam nila kung paano yung proper techniques, kung paano nila i-lift, diba, yung mga patient nila, and also yung posture, kung paano mo sila ililift. So, we have number 5, the violence and aggression. So, violence and aggressions or aggressive behavior in caregiving, especially when dealing with patients with dementia. So, dementia is, one of the example of dementia is the Alzheimer disease. So, mental health condition or developmental disabilities. The example of developmental disability disabilities or yung mga, if may mga, yung mga patient nila na may mga autism, cerebral palsy, Down syndrome, may mga behavioral disabilities. So, caregivers may encounter aggressive or violent behavior. So, as a caregiver, di ba, as a caregiver, hindi, so, so, very self-explanatory naman, di ba? So, as a caregiver is, kailangan alam mo kung paano mo i-deal yung mga patient mo. Example na din yung mga patient pang with leukemia, which is may mga Alzheimer, may high blood pressure, mental health. Alam mo dapat kung paano sila i-deal. So, what are the prevention? Para hindi violence and aggression. So, violent and aggression behavior in caregiving, especially when dealing with patient with leukemia, which is yung mga patient na may mga Alzheimer disease. Mental health condition like yung mga may anxiety, yung mga depressed, and or developmental disabilities, yung mga people na may autism, may cerebral palsy or yung Down syndrome, and also behavior disabilities. So, caregiver may encounter aggressive or violent behavior. Like, if yung patient mo may high blood, ganyan, if mainitin yung ulo, ganyan, ay sometimes yung mga patient, ang mga caregivers is nagiging aggressive sila. Minsan nasasaktan nila yung mga caregivers nila. So, what are the prevention? So, ensuring the care plans are tailored to the individual. So, kailangan na dapat mong i-ensure na yung pag-aalaga mo is naka-fit sa patient mo. For example, if your patient have a leukemia or Alzheimer's disease, dapat alam mo kung paano siya i-deal. And also, if your patient have a hypertension or which is high blood, dapat alam mo kung paano siya i-deal. Dapat alamin talaga natin, or alamin nyo, dapat alamin talaga ng mga caregiver kung paano nila i-deal yung mga patient nila. So, para ma-reduce, reducing the trigger or aggression, para ma-reduce yung mga triggers and aggression ng mga patient nila. So, maintaining a safe and calm environment. So, dito is kailangan alam mo kung paano dalhin yung mga patient mo. Like, for example, if may mga sakit sila, di ba? Kailangan alam mo kung paano sila dalhin. Kung paano sila alagaan, ganyan. Alamin mo kung ano yung ayaw nila at saka gusto nila. Para ma-reduce yung aggressive. Para hindi sila maging aggressive. Tsaka violent. So, 6, we have the chemical safety. So, exposure to hazardous chemicals. Caregivers may encounter chemicals such as cleaning agents, disinfectants, or medication. So, here in exposure to hazardous chemicals, so yung mga caregivers natin is naka-expose sila sa mga chemicals such as cleaning agents and disinfectants and medication. So, yung mga caregivers kasi natin, sila yung dapat naglilinis sa mga materials and saka bed ng mga patient nila. Naka-expose sila sa mga harsh chemical or mga chemicals na nagkakaroon na, or yung mga chemicals na hindi dapat dadapo sa skin natin para hindi tayo magkakaroon ng skin disease, or yung mga cleaning agents, may mga chemicals talaga yun sila. And also yung mga medication ng mga patient niyang, and also yung mga medication ng patient na may sakit. So, what are the prevention to prevent this kind of hazardous chemicals? So, proper training on handling chemical safety. So, 'di ba, kailangan as a caregiver, alam mo kung paano i-handle yung alam mo kung paano gamitin yung mga chemicals, like yung 'di ba, yung cleaning agent. Alam natin kung ano yung mga chemicals na meron sa mga cleaning agent. And also yung medication, dapat alam natin kung ano yung chemical na nandun sa medicine ng patient natin. So, use of PPE, gloves, mask, goggles when handling harmful substances. So, for example lang nga, if you're cleaning, di ba, like you're using a disinfectants or some cleaning agents, kailangan gumamit talaga kayo ng gloves or mask. Kasi, yung mga cleaning agents natin, it contains harmful chemicals like yung parang harmful chemicals which can lead to skin allergy or skin infection. So, clear labeling and safe storage for chemicals. So, kailangan if you're example, yung mga medication or mga medicines ng ng patient mo, kailangan may mga clear label siya and also safe storage para sa mga chemicals. So, number two, fatigue and long working hours. Exhaustion. Long working hours, irregular shifts, and demanding workloads can lead to fatigue and impaired judgment. So, when we say impaired judgment, it's the ability to make decision which can negatively impact both caregivers and patient safety. 'Di ba, as din as a student and also teachers experience this. Hindi lang yung mga caregivers yung nakaka-experience ng fatigue and nagiging nag-experience ng exhaustion. So, as a student, 'di ba, always if pagod tayo galing sa school, yung parang hindi na natin alam ano yung next na gagawin natin. Hindi na natin alam ano yung gagawin natin, 'di ba? Dahil sa pagod. So, prevention, ensuring regular shift schedules and proper rest. So, kailangan as a caregiver, magkakaroon ka din ng rest. You should have a rest also. So, encourage caregiver to take regular breaks. So, kailangan is take a break ka din muna sa mga works mo. Take a break ka din sa pagiging caregiver mo. You should also spend time together with your family to prevent these fatigues and exhaustion. So, implementing work-life balance initiatives. So, here in implementing work-life balance initiatives is kailangan hindi lang naman ikaw yung mag-isa. So, in implementing work-life balance, implementing and work-life balance initiative. So, self-explanatory naman talaga siya, di ba? So, number 8, we have the client safety. So, client-related risks, the safety and well-being of clients are essential to occupational health and safety. Preventing falls, ensuring correct medication administration, and providing safe mobility assistance are all parts of client care. So, in client safety, yung preventing falls and ensuring the correct medication. So, kailangan talaga, if you're old or yung mga lola and lolos nyo na walang nag-aalaga, is kailangan talaga is mag-hire kayo ng caregiver para may mag-aalaga sa kanila, may magpapakain or may magpapatake ng medicines nila correctly. Na mali yun. So, client safety, client-related risks, the safety and well-being of clients are essential to OHS or occupational health and safety, which preventing falls, ensuring correct medication and administration, and providing safe mobility and assistance are all part of client care. So, as a caregiver is kailangan gawin natin yung part natin is just yung alagaan natin yung patient natin or yung patient nyo. So, dapat ensuring the correct medication, kailangan painumin natin sila ng gamot, and also papakainin natin, aalagaan natin, di ba, as a caregiver. So, prevention. So, conducting a regular safety assessment of client living environment. So, very self-explanatory naman, di ba? Kailangan is yung environment ng client is.
So, following proper medication management protocols, so here, kailangan is sumunod tayo kung anong oras iinom yung gamot yung pasyente natin, and using mobility aids to ensure they are functioning properly. So, here in using since they're properly para ma-prevent yung accident. So, key OHS practices in caregiving. So, number one, we have the training, regular training and education, di ba? As a caregiver, hindi naman sila magiging caregiver kaagad kung hindi sila mag-aaral. So, caregiver should undergo ongoing training and safety protocols, infection control, and manual handling, di ba? As what I've said kanina na hindi sila naging caregiver kaagad kasi they undergo some trainings and how to manage the manual handling and emergency procedures like first aid. So number two, we have the monitoring and reporting system. So very self-explanatory naman siya, di ba? So there should be system in a place to report hazard, injuries, and unsafe practices. So reporting and addressing issues. Health and wellness programs. So employers should provide programs that promote the physical and mental health of caregivers, such as fitness initiative, stress management training, and access to counseling. So here in health, so they should provide the programs that can promote the physical and mental health of the caregivers kasi hindi biro yung pagiging caregiver kasi it could impact your emotional, physical, and mental health. So, personal protective equipment or PPE. So, caregivers should be trained in the proper use of PPE, especially in the high-risk environments such as hospitals or homes with clients who have infectious conditions. So, here in personal protective equipment, so kailangan is they know how to use it properly because they're going to handle some patient who are sick, yung mga may malulubang sakit. So, kailangan alam nila kung paano gamitin yung PPE para hindi sila mahawaan. So, compliance with regulatory standard. In many countries, so OHS regulation are enforced by government bodies. So, in the United States, caregiving organizations should comply with the all local, state, or national health safety regulation. So, self-explanatory naman siya, di ba? So, six is safe work environment. So, ensuring the physical environment is safe, including removing hazards like wet floor, ensuring good lighting, and having safe furniture and equipment. So, caregiver also need a physical environment which is safe, which can safe and also remove some like wet floors and ensuring the good lighting para makita nila or mabantayan nila na maayos yung patient nila, and having a safe furniture and equipment like if for example you have furniture na alam mo makaka-harm sa patient mo or sa caregiver, di ba? Hindi naman natin siya ilalagay, di ba? Tatanggalin natin siya. So, in conclusion, occupational health and safety in caregiving is crucial for caregivers and patients, preventing injuries, burnout, and stress, enhancing care quality, and workforce sustainability. So, it is very crucial for both caregivers and patients para ma-prevent yung injuries and burnout and stress. So, para alam nila kung ano yung gagawin nila, and also para ma-enhance yung care quality and workforce sustainability ng ating caregivers. That's all. Thank you.